I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Somewhere right now in a stainless steel tank at minus 196 degrees Celsius, there are thousands of frozen embryos. Some belong to couples who already have babies. Some belong to couples who got separated. Some belong to couples who passed away. But here's the haunting question no one talks about. What really happens to unused frozen embryos? Let's see what happens. But what is a frozen embryo to begin with? Let me simplify it. A frozen embryo is a fertilized egg already containing both maternal and paternal DNA. It already carries the genetic blueprint of a future baby. During IVF, multiple embryos are created. One or two are transferred. The rest are frozen for future use. These embryos are preserved in liquid nitrogen at minus 196 degrees centigrade. This is where no aging occurs, no genetic damage happens, no biological activity continues. To say that they are not alive won't be very wrong, but they're also not dead. They are suspended in time potentially. So, how long can embryos stay frozen? This may shock many people. Embryos can stay frozen for 10, 20 and even 30 years with no loss of genetic quality. There is no expiry date decided by nature. Only legal and ethical limits decide storage duration. Children have already been born worldwide from embryos frozen for 12 years, 15 years, even over 20 years. To science, time does not exist inside the freezer. So what options do couples have for unused embryos? Well, once a family is completed or circumstances change, couple must eventually make one or three of these decisions. Option 1 is to use them later. Some couples freeze embryos after first baby, return years later for a sibling. This is the happiest outcome. But option 2 could be donate for research. Some embryos are donated for stem cell research, genetic disease research, IVF advancement. These embryos help improve success rates for future patients. Third option is to discard embryos. This is the most painful decision. These embryos are allowed to thaw and naturally disintegrate or degenerate. Nothing dramatic, no procedure, just silence. And for many couples, this moment carries deep emotional grief. Why this decision is so emotionally heavy? Well, for doctors, it's a medical decision. For patients, it's an emotional and moral crossroad. Couples struggle with guilt, confusion, religious belief, emotional attachment. There is a question of what if. These thoughts. Some couples delay this decision for 5 to 10 years, paying for storage, not because of money, but because their hearts aren't ready. Many say, doctor, that embryo could have been my son, my daughter, and that single sentence carries a lifetime of emotions. So what happens if couples disappear or pass away? Sometimes couples do separate, isn't it? They migrate, stop responding, or pass away. Clinics legally cannot destroy embryos without clear consent policies. This is why modern IVF consent forms clearly ask, who decides if one partner dies? What happens after divorce? What if there is no response for years? These are not legal documents, these are future emotional safeguards. Frozen embryos are not just laboratory cells, they are past possibilities. They carry love, loss, hope, regret, second chances, and not every embryo will become a baby, but every embryo carries a story. And the untold truth is this: the hardest part of IVF is not injections, not retrieval, not embryo transfer. It's deciding what to do when hope no longer is needed but stored in ice. If you wish to know more, please feel free to contact us.